It's that time of year to decide on your health care plan. Today, Michelle Brownell from United Healthcare is here to discuss Medicare Advantage. Welcome to the blend, Michelle. How are you?
I'm doing fine, Natalie. Thank you for having me.
Well, we are glad you are here because right now, I don't know if you guys feel me out there, but it seems that so many commercials are all talking about open enrollment. We're getting it from our employers. But when it comes to Medicare, why is open enrollment so important?
It is extremely important because it's the one time in which individuals have the opportunity to change their Medicare coverage for the upcoming year in 2018. And if they don't make that change, they could be locked in for whatever they currently have. And if anything's changed in their benefits or their health status, then they're kind of stuck throughout the rest of 2018. And when you think about it, Medicare enrollment is from October 15th through December 7th, and that may seem like a long time, but it's really a little less than 2 months. And as of today, there's only 36 days left in that open enrollment period.
So 36 days and counting.
Yes.
Got to hit that deadline. And I know there are several parts to Medicare that we kind of want to dive into, and maybe you can help answer some questions. I hear things like Part A, Part B. I kind of don't know the parts. What exactly are we talking about, Michelle?
A little bit like alphabet soup, right? It's kind of like all of these, yeah. So there are really 4 parts to Medicare. You do have Part A, Part B, Part C, and Part D. So Part A is your inpatient hospital services and a little bit about skilled nursing services. Part B would be your doctor visits and your hospital outpatient hospital services, lab and x-ray. And then you have Part C, which is the Medicare Advantage. But I also think Part C is kind of combo, C for combo. And what it does is it takes the Part A, the Part B, and also the prescription drug component, which is Part D, and kind of combines them all into Medicare Advantage, which is Part C. And with Medicare Advantage, you get additional services that aren't covered under original Medicare. So things like dental and vision and hearing, and also fitness. And I got to tell you, seniors love their fitness programs or gym membership, which is covered under Medicare Advantage.
See, I don't even love my gym membership, but I have to do it. But I'm glad to hear the seniors are loving it. And so you've got the different parts, which can be a lot of confusing. And I know there's a lot of icky waters. Any advice for people who are getting ready to enroll?
Yeah, so this is really a good time. Like I mentioned, there's 36 days left, but I would take the opportunity now to self-assess and kind of self-reflect on, has anything changed with me as an individual in the past 12 months, like my health status or even my financial status? Past 12 months, past 6 months, maybe even the past 90 days now that some folks have been impacted by Hurricane Irma. And then to take that and we can simplify it into 3 categories. That would be choice, care, and experience. So when you think about choice, it's not one size fits all. There are a lot of great options out there. You mentioned all of the commercials that are taking place. There are a lot of great options out there, and this is the time for people to think about, am I getting the most out of my current insurance plan that I have today? Then you think about care. Everybody should have access to great quality of care. So they should consider, is my primary care physician in my current plan or in the network? Are the specialists that I'm seeing today or maybe need to see, are they also participating in the network? What about the local hospital systems that are here? Are they participating? Are my prescription drugs that I have to take, are they also included in the plan? And then you have experience. Everybody should have an option and should be able to have the resources available to them to live a healthier life and to be able to maximize benefits. So when you think about experience, in my current plan today, do I have additional benefits available to me? Am I maximizing those additional benefits? Am I taking advantage of them?
Okay, I love how you just broke that down and made it very simple for everybody to consider those. And I know you have some more resources too that people can log on and gain more information too.
Yeah, absolutely. I mean, I think I saw a recent survey where it said 40% of Medicare beneficiaries are confused about Medicare and the Medicare program.
Yeah.
And so resources available to them, you can certainly go on to the United Healthcare website, which is uhcmedicareplans.com. You can also call 1-800-821-0287. And then there's